Welcome to this important video about hypothyroidism, a condition that affects many people, especially as we age. In this video, we'll explore the symptoms of hypothyroidism, a condition where your thyroid gland doesn't produce enough thyroid hormone. Hypothyroidism can be subtle at first, and many people may not even realize they have it, which is why it's crucial to understand the signs and symptoms. The thyroid is a small butterfly-shaped gland located at the front of your neck. It plays a key role in regulating many of your body's functions, including metabolism, energy production, and even mood. When your thyroid doesn't produce enough of its hormones, it can lead to a number of health issues. As we age, our risk for thyroid problems increases. The symptoms of hypothyroidism can often be mistaken for normal signs of aging, which is why many people might not seek help right away. But recognizing the symptoms early can help you manage the condition before it causes more serious problems. Common symptoms of hypothyroidism. Hypothyroidism can manifest in a variety of symptoms that impact your daily life. One of the first signs to watch for is persistent fatigue. Unlike regular tiredness, this fatigue doesn't go away with rest or a good night's sleep. It feels like an overwhelming sense of exhaustion, and no matter how much sleep you get, you might still feel drained and sluggish. This constant tiredness is because your thyroid, which is responsible for regulating energy production in your body, isn't functioning properly. Without enough thyroid hormones, your metabolism slows down, and your body has to work harder to perform basic functions, leading to exhaustion and a lack of energy. The fatigue associated with hypothyroidism can make it harder to concentrate or focus on tasks that you previously managed with ease. Even simple activities can feel more challenging, and it can feel like you're constantly dragging yourself through the day. Many people find that they can't stay awake for long periods, and they may take frequent naps or feel like they could sleep at any time of day. Weight gain is another common symptom that often accompanies hypothyroidism. If you've noticed that your weight has been creeping up even though you haven't changed your diet or exercise habits, this could be a sign of a slow metabolism caused by low thyroid hormones. When your metabolism slows, your body starts storing fat more readily, leading to unexplained weight gain. This weight gain often occurs gradually, and you might not even notice it at first, but it becomes apparent over time as your clothes feel tighter or your scale number increases. In addition to fatigue and weight gain, many people with hypothyroidism also experience dry skin and hair. Your skin may feel rough, dry, or flaky, and even lotions and moisturizers may not help. Dry skin occurs because your body is unable to produce enough oil to keep your skin moisturized, and the slower metabolism also impacts the hydration levels of your skin. Hair loss or thinning is another common symptom. You might notice more hair in your brush or shower drain, or your hair may become thinner overall. This happens because the growth cycle of your hair slows down, and new hair isn't produced as quickly due to insufficient thyroid hormones. Other symptoms to watch out for. Hypothyroidism can also cause mood changes and affect your mental clarity. One of the key functions of thyroid hormones is regulating the brain's mood centers, so when these hormones are low, it can lead to feelings of depression, anxiety, and irritability. You might feel down or overly anxious without any clear reason, and you may notice that it becomes more difficult to stay positive. These mood swings can interfere with daily life, affecting your relationships and work performance. Cognitive function may also decline. People with hypothyroidism often experience brain fog, difficulty concentrating, or forgetfulness. It can feel like you're not thinking as clearly as you normally would, and even simple tasks may seem harder to complete. This mental sluggishness can be frustrating, especially if you have always been mentally sharp in the past. Joint and muscle pain are also commonly reported by those with hypothyroidism. You might experience stiffness or swelling in the joints, as well as aches and pains in the muscles. The lack of thyroid hormones affects the body's ability to repair tissues, leading to inflammation and discomfort. These symptoms can be particularly bothersome, especially if you are used to being physically active and suddenly feel restricted due to pain. Another telltale sign of hypothyroidism is cold intolerance. If you find yourself feeling unusually cold, even when others around you seem comfortable, this could be due to low thyroid hormone levels. Thyroid hormones help regulate body temperature, and without them, your body can struggle to maintain a normal temperature. You may notice that your hands and feet are particularly cold, or you might need to wear extra layers of clothing to feel warm. This sensitivity to cold can be particularly noticeable in cooler environments or during the winter months. Cardiovascular symptoms. Hypothyroidism doesn't only affect your metabolism and energy levels, it can also impact your cardiovascular health. One of the more concerning symptoms of hypothyroidism is a slower heart rate. This can cause you to feel lightheaded, especially when standing up quickly or making sudden movements. The slower heart rate is a direct result of the lack of thyroid hormones, which help regulate the electrical impulses that control the heart's rhythm. Some people with hypothyroidism may also notice irregular heartbeats, which can feel like palpitations or skipped beats. These irregularities can be mild or more pronounced, but they should not be ignored. Additionally, hypothyroidism can cause an increase in cholesterol levels, which can raise your risk for cardiovascular diseases, such as heart attacks or strokes. High cholesterol is a common side effect of low thyroid hormone levels, and it is important to monitor and manage this condition through diet, exercise, and medication if necessary. Given the connection between hypothyroidism and cardiovascular health, it's important to address any symptoms promptly to prevent long-term heart problems. Early treatment with thyroid hormone replacement can help regulate your heart rate, reduce cholesterol levels, and improve overall heart function. Digestive issues. Hypothyroidism can also wreak havoc on your digestive system. A common symptom is constipation. If you find that you are experiencing less frequent bowel movements or difficulty passing stool, this may be due to low thyroid hormones. The thyroid plays a role in regulating the digestive process, and when hormone levels are low, it can slow down the movement of food through your intestines, leading to constipation. In addition to constipation, some people may experience bloating, indigestion, or a feeling of fullness in their stomach. These digestive issues can contribute to discomfort and may be a sign that your thyroid is not functioning as it should. Fortunately, once your thyroid hormone levels are normalized through treatment, these digestive issues can often improve significantly, leading to better overall comfort and digestive health. Impact on memory and concentration. Cognitive issues such as memory lapses and difficulty concentrating are some of the most common symptoms of hypothyroidism. If you find yourself misplacing keys more often, forgetting appointments, or struggling to retain information, it may be due to low thyroid function. This cognitive fog, often referred to as brain fog, can affect both short-term and long-term memory, making everyday tasks more challenging than before. This symptom can be particularly alarming for older adults, as it may be mistakenly attributed to early signs of dementia or age-related cognitive decline. However, once thyroid function is properly restored through treatment, many people report significant improvements in their mental clarity, focus, and memory retention. It's important to recognize that while cognitive decline can be a sign of hypothyroidism, it can also be reversed or significantly improved with proper thyroid management. For many individuals, as thyroid hormone levels stabilize, mental fog lifts, and concentration returns to normal, making cognitive difficulties less of a concern. In addition to memory problems, people with hypothyroidism might experience difficulty multitasking or processing information quickly. The sluggish metabolism affects brain function, making it harder to stay sharp and attentive. Fortunately, once you address the thyroid imbalance, mental alertness tends to improve, and the brain can function more efficiently. The impact on your hair and nails. One of the telltale signs of hypothyroidism is the noticeable thinning or loss of hair. This happens because thyroid hormones are crucial for the regulation of hair growth and the health of your hair follicles. When thyroid function is low, the growth cycle of your hair is disrupted, and the hair follicles may become weaker or even stop producing new hair, resulting in shedding. This can lead to thinning hair or even patches of baldness, which is especially noticeable for people with hypothyroidism. Hair loss is typically more gradual, and in many cases people may not notice it right away. In addition to thinning hair, the texture of your hair may change. It can become dry, brittle, or more coarse than usual, and no amount of moisturizing or hair treatments may seem to help. If you have noticed that your hair seems lifeless, flat, or falls out more than before, hypothyroidism could be the underlying cause. Hypothyroidism doesn't only affect your hair, it can also have a significant impact on your nails. Many people with low thyroid function notice that their nails become brittle, dry, or prone to breaking easily. You may also notice ridges in your nails, which can make them appear uneven or weak. Over time, this can affect the overall appearance of your nails and make them more susceptible to damage. Just as with your hair, addressing thyroid imbalances is the key to restoring nail health. Once thyroid levels are corrected, your nails may gradually regain strength and become less prone to breakage, but this process can take several months. Changes in menstrual cycle. Hypothyroidism can cause significant disruptions to the menstrual cycle for women. One of the most noticeable effects is heavier or longer periods than usual. If you find that your menstrual flow has increased in intensity or duration, or if you are experiencing periods more frequently than before, this could be linked to thyroid dysfunction. The thyroid hormones play a crucial role in regulating the hormonal balance required for the menstrual cycle, and when these hormones are out of balance, the result is often irregular or heavy periods. In addition to changes in flow and frequency, some women with hypothyroidism may experience periods that are spaced further apart. This is due to the hormonal imbalances that occur when thyroid function is insufficient. The body's production of thyroid hormones affects the production and regulation of other hormones, such as estrogen and progesterone, which are responsible for regulating the menstrual cycle. Therefore, when thyroid hormone levels drop, the body struggles to maintain a normal menstrual rhythm, leading to changes in the cycle. For women who are trying to conceive, hypothyroidism can also affect fertility. Low thyroid hormone levels can make it harder for the body to conceive, and it may take longer to get pregnant. The thyroid hormones influence ovulation, and a lack of these hormones can prevent ovulation from occurring regularly. If you notice significant changes in your menstrual cycle, whether it be heavier, lighter, more frequent, or irregular periods, it's important to discuss these changes with your healthcare provider. Proper thyroid management can help restore hormonal balance, regulate menstrual cycles, and improve overall reproductive health. The connection between hypothyroidism and sleep issues. People with hypothyroidism often experience sleep disturbances, including insomnia or trouble staying asleep. Your thyroid helps regulate your body's sleep-wake cycle, so when your hormone levels are low, it can make it harder to fall asleep or stay asleep through the night. You may also feel that you sleep a lot, but still wake up feeling tired. This is common among those with hypothyroidism, as the body is not able to get the restorative sleep it needs to feel rested and energized. Diagnosing hypothyroidism. If you recognize several of these symptoms in yourself, it's essential to get tested. Hypothyroidism is diagnosed through a blood test that measures your levels of thyroid hormones, such as TSH, thyroid-stimulating hormone, T3 and T4. If your thyroid function is found to be low, your doctor can help you develop a treatment plan to restore balance. Most commonly, hypothyroidism is treated with synthetic thyroid hormone medication. This medication helps replace the hormones your thyroid is not producing, bringing your body's levels back to normal. Treatment is typically lifelong, but with the right care, hypothyroidism can be managed effectively, and you can lead a normal, healthy life. Treatment and lifestyle changes. In addition to taking thyroid medication, there are lifestyle changes that can help manage hypothyroidism and improve your overall health. Eating a balanced diet rich in nutrients can help support your thyroid function. Foods like leafy greens, whole grains, lean proteins, and healthy fats provide the necessary nutrients to help keep your metabolism running smoothly. It's also important to stay physically active. Regular exercise can help boost your metabolism, improve energy levels, and support overall well-being. Even gentle exercise like walking or yoga can have a positive impact on thyroid health and improve your symptoms. Managing stress is another crucial aspect of thyroid health. Chronic stress can exacerbate symptoms of hypothyroidism, so finding ways to relax, such as through meditation, deep breathing, or spending time outdoors can be beneficial. When to seek help. If you're experiencing any of the symptoms of hypothyroidism, it's important to speak with your healthcare provider. Many of these symptoms can overlap with other conditions, so getting an accurate diagnosis is essential. Your doctor will conduct the necessary tests to determine if hypothyroidism is the cause of your symptoms. Once diagnosed, your treatment plan may involve thyroid hormone replacement therapy, which is very effective in managing the condition. Remember, it's important not to ignore persistent symptoms. hypothyroidism is manageable, and with proper treatment, you can feel better and regain your quality of life. In conclusion, hypothyroidism is a condition that affects many people, particularly as they age. The symptoms can be subtle and often mistaken for other issues, which is why it's crucial to pay attention to the warning signs. If you notice any of the symptoms we've discussed, don't hesitate to seek medical advice. By understanding the early signs and symptoms of hypothyroidism, you can take proactive steps to manage the condition and improve your overall health. Treatment is available, and with the right care, you can continue to live an active, healthy life. Thank you for watching this video. If you found it helpful, be sure to share it with others who might benefit from this information. Remember, your thyroid health is important, and staying informed is the first step to feeling your best.